Hi everyone, welcome to my channel. This is the part 2 of the humerus. I have given the link of part 1 in the description box and in the I button. Check it out. So let's start with the attachment. First I will be saying about the insertion. So insertion means that already these muscles have originated from the scapula. Okay, you have seen this muscle origination in the scapula. Now they are coming and inserting into the humerus. Okay, first is the subscapularis muscle. Subscapularis muscle is inserted in the lesser tubercle. So this is the lesser tubercle and it is inserted in the lesser tubercle. Then we have the supraspinatus muscle, which is present in the uppermost impression of the greater tubercle, and the infraspinatus muscle is present in the medial impression of the greater tubercle, and the teres minor muscle is present in the lower impression of the greater tubercle. The impression are not prominent in the bones which I am having. If you are having the prominent bone, then please check it out from them. So the three impressions, you will get the attachment of the three muscles of the greater tubercle, that is the infraspinatus muscle, teres minor muscle, and the supraspinatus muscle. Okay, then we have the pectoralis major muscle. Pectoralis major muscle is present in the lateral lip of the intertubercular sulcus. So this is the lateral lip of the intertubercular sulcus beside the greater tubercle. So here you will get the pectoralis major. Okay, and in the medial lip you will get the teres major. Okay, here there will be the pectoralis major in the lateral lip. In the medial lip there will be teres major. Between the two major muscles there will be, in the floor there will be latissimus dorsi. Okay, in the floor of the intertubercular sulcus there will be latissimus dorsi muscles. Okay, now deltoid muscle. Deltoid muscle will be present in the deltoid tuberosity. Okay, of that V-shaped deltoid tuberosity which you have identified, here you will get the deltoid muscle. Coracobrachiolis muscle, for that you have to go in the medial area. So okay, so in the medial border, the rough area you will get here. Okay, see here the rough area you will get here. Here you will get the coracobrachiolis attachment. Okay, so this all are the insertion. But one question they may ask that what are the content of the intertubercular sulcus? So intertubercular sulcus also contain the tendon of the long head of the biceps brachii and the synovial sheath, and the ascending branch of the anterior circumflex humeral artery. Okay, this content they ask that what are the content of the intertubercular sulcus. Okay, so next then I have already finished the insertion. I will be talking about the origin now. Origin means this muscle takes origin from the humerus itself. So brachialis, the lower half, in the anterior medial and the anterior lateral surface, of the shaft, you will find the brachialis muscle. Then we have the brachioradialis muscle in the upper 2/3 part of the lateral supracondylar ridge. So this is the lateral supracondylar ridge we are having. So in the upper 2/3 part, here you will get the brachialis, in the brachioradialis in the front. Okay, extensor carpi radialis longus muscle. Okay, this muscle you will get in the lower 1/3 of the lateral supracondylar ridge. So this is the supracondylar ridge. Above 2/3 part you are getting brachioradialis, and lower 1/3 you are getting the extensor carpi radialis longus. Now come to the medial supracondylar ridge. Pronator teres is present in the lower 1/3 of the medial supracondylar ridge, and the superficial or the common flexor muscle is present in the anterior aspect of the medial epicondyle. So this is the medial epicondyle. So here you will find the common flexor muscle. Okay, common extensor muscle you will get, on the supinator muscle you will get in the lateral epicondyle. So here you will get the supinator muscle and the common extensor muscle. Remember, extensor muscle will be present in the lateral side and the flexor muscle will be present in the medial side. Okay, the anconeus muscle, for that you have to look behind or in the posterior surface. So this is the lateral surface, lateral epicondyle. So in the lateral epicondyle behind you will get the anconeus muscle, posterior side. Okay, and lateral head of the triceps brachii and the medial head of the triceps brachii. For that you need to identify the radial groove. So the radial groove in the posterior side, I have shown you that there is a oblique line you will get. This is the radial groove. Okay, this is the radial groove. This is also not prominent in this bone. So check it out from your bone. So the lateral head of the triceps brachii will be present above this radial groove, and the medial head of the triceps brachii will be present in the lower half of the radial groove. Okay, So this muscle attachment you have to remember. Lateral head of the triceps brachii above, medial half of the triceps brachii below the radial groove. Okay, so these all are the muscles origination and the insertion. So there are capsules. As I have said you, if there are the joints, then there will be capsule for the maintenance of the joint. So there are two capsules as because two joints it is forming. With the scapula it is forming the shoulder joint, and with the ulna and the radius it is forming the elbow joint. Okay. So there are the capsular ligament of the shoulder joint, which you will find it in the across the head. So where the glenoid cavity will be attached, it gives the stability to the shoulder joint, and the capsular ligament of the elbow joint, it gives the stability to the elbow joint. Okay. So this all are the attachments. So moving into the clinical, there are actually important nerves which passes by this humerus. First is axillary nerve. Axillary nerve you will find in the surgical neck. Okay, here surrounding the surgical neck you will get the axillary nerve. Okay, radial nerve you will find of course in the radial groove. So this is the radial groove. I have said you above there is the medial lateral head and the medial head of the triceps brachii. So in the radial groove you will find the radial nerve. Ulnar nerve you will find in the behind the medial epicondyle. So this is the medial epicondyle. Behind you will find the ulnar nerve. So again I repeat, there are axillary nerve in the surgical neck. Radial groove there is the radial nerve, and in the ulnar nerve it is present in the behind the medial epicondyle. So as these three nerves are present, so these are the places which is liable to injury. Okay. Second, there is the VOLKMAN'S ischemic contracture. VOLKMAN'S ischemic contracture is supracondylar fracture. Okay, this supracondylar fracture are more common in the young age. So it is produced by a fall on the outstretched hand. The lower fragment are mostly displaced backwards so that the elbow is unduly prominent. So you will find in this fracture that the elbow will be prominent. You can feel the elbow. Okay. As is there is a dislocation on the elbow joint. If there is a dislocation in the elbow joint, there will be prominence, unduly prominence of the elbow joint. And this fracture may cause the injury to the medial nerve. So the fracture in the elbow may cause the injury to the medial nerve. In that fact, the brachial artery occlusion occur, because you know that the median artery is a part of, the median nerve is a part of the brachial plexus. Okay. So in the brachial artery will be occluded. So this is called as the VOLKMAN'S ischemic contracture. Okay, and the head of the humerus is also more prominent. Also is liable to injury very commonly. Okay, there are the clinicals. The important questions which your viva or your examiner may ask is first the attachment of the bicipital groove and its content, means in the intertubercular sulcus what are the attachment and what are the contents of the bicipital groove. Next, the two head of the biceps brachii attachment, the nerves, important nerves which I have said you that attachment they will ask, and the medial and the lateral supracondylar ridge attachment, which what are the muscles present front and in the behind, and the carrying angle. Carrying angle I have not told you. In the trochlear, there see the medial edge is more downward than the lateral edge. Okay, this medial edge is more downward, 6 mm downward than the lateral edge. This helps in giving the carrying angle. Carrying angle is the small degree forms which is formed between the axis of the radially diverted forearm and axis of the humerus. So it is 5 to 15 degree away from the body and 165 to 175 towards the body. So this is the carrying. This helps in giving the carrying angle. Okay. So if this was a little help to you, then do subscribe, like, share and comment. Thank you.